Hi, Don here. Welcome to Podiatry Practice Mastery. Wanting to help you get your practice to the $1,000,000 mark. Want to go over the most valuable patients of the day. First was a 66-year-old female. She was coming in for EPAT number 5 for her Achilles tendon. She has pain on the left Achilles, kind of swelling in the back, kind of like a posterior spur, but want to avoid doing like a Haglund's repair for her. So we did 3 sessions of shockwave, took a 6-week break where she did physical therapy, and then we're on number 5. So we do one more, so it's up to number 6. So what I usually do is the first 3, 6-week break, and then if I do another 3, then I'll do a 12-week break because it takes a little bit longer. But she's getting much, much better, having reduced swelling back in the heel. So it's another one we can avoid doing, like a speed bridge type of a procedure. Another patient that came in, she's a 21-year-old female that has had a painful os peroneum bilaterally, and she has had, by another provider, multiple cortisone injections, recently Medrol dose pack because of pain, and then she was placed in a cam boot because she was just limping around so much. So what did we do for her? Well, she had had x-rays. It showed a very small os peroneum, and I decided to get an ultrasound because the ultrasound I could see where the peroneus brevis inserted into the 5th med base. I could see where the cuboid notch was, where the that os peroneum was, and that specifically is where it was hurting her. Now, the cortisone the last time was done without ultrasound guidance, so I gave her a couple of options. I gave her the ultrasound guided cortisone injection option. We talked about removing it. It's kind of a hard bone to remove, that little bone in there. And then we also talked about shockwave therapy. So she did opt for shockwave. So what we did for her was 6 sessions of shockwave for the 5th med, kind of the 5th med base cuboid notch region. We're going to do focused and radial. So she's going to be having those in the office. So that was kind of the largest check. And then the last one, I was recently at that shockwave conference, and they talked about doing shockwave for knee arthritis. There was a gentleman from Colombia. He was an orthopedist and doing it kind of for knee arthritis. I liked the idea because there are certain types of arthritis. For example, I saw one, she's a 70-year-old female, and she has midfoot arthritis. And anyone that knows about midfoot arthritis, she has some beaking on the top of the foot. That's a hard diagnosis. She's already had cortisone injections in the past. She says they were very painful. We talked about doing like a meso brace. That's if you don't know, it's an AFO type of a brace that's like a gauntlet right around the midfoot. Kind of hard to fit in a shoe. She already has an orthotic. And so I talked to her about doing shockwave. So the idea is, if I could find out, it's not going to take away the arthritis. I know that. It's not going to bring back cartilage. I know that. But if a lot of the pain is coming from bone marrow edema or swelling around there, I think the shockwave can bring that down. And so what some people are advocating is doing 3 sessions of shockwave per year to kind of keep it at bay, and then some type of an orthotic to not have it move as much. So that was my recommendation for her. I'm not sure if she's going to take me up on it. And then finally, what I've been realizing with using these patient presentations, I've added a couple of new ones. If you do look at my patient presentations, if you don't, you can get them at patientpresentations.com. But I added one on ulcers, kind of a simple one, and I added one on shin splints where it talks about shockwave for shin splints and some of my protocols for ulcers. But with the presentations, they're for most musculoskeletal things. I talk about reducing the pain, reducing the tightness, and then reducing the stress through your foot. So I've been kind of explaining it in a new way. Reducing the pain is like, cortisone, shockwave, things like that. Reducing the tightness is usually with foam rolling or PT or a night splint. But then reducing the stress, I kind of put that in a different category, as if, like, I don't find that those things really take away the pain, but I find that they help the pain from coming back. So this is something I learned at the recent AAPPI meeting, was that certain treatments help take away the pain and other treatments help it from not coming back. So that's the whole idea of the orthotics. As I'm explaining it, I'm saying, the shockwave, the foam rolling, things like that, they're going to help take away your pain. And the orthotics are going to help it not come back by stabilizing your foot, especially those joints. Anyway, those are my thoughts today. love to know your feedback. Shoot me an email, don@podiatrypracticemastery.com. Let me know if these are helping you, or if you're interested in these types of sessions, these types of podcasts. Okay, thanks.